Another theory, relatively new thought process, is that there might be a piece of this picture related to angiogenesis. And so angiogenesis is just when we grow new blood vessels. It's certainly important in life, right? That's part of our tissue growth. However, if angiogenesis gets out of balance, it increased the risk for a variety of conditions: age-related blindness, macular degeneration, cancer, certain skin diseases, stroke, and cardiovascular disease. And it's thought that once those endometriotic lesions, have been somewhere outside of the uterus, part of the way that they're growing and really implanting is due to angiogenesis. Surgical intervention, so you can go in and have those implants removed. The endometrioma, those cysts can be removed as well. And it is thought that that will improve pregnancy rates, if that was a major reason for the fertility challenges. And then oftentimes when women are through with their childbearing, hysterectomy will be recommended. And it's not too uncommon for people to choose that option. All right, let's look at natural stuff. So first off, I think it's important to look at the diet, since we know that we have an inflammatory condition. An anti-inflammatory type diet will be helpful. And there's a lot of good evidence, particularly pointing to an omega-3 fatty acid rich diet, and a diet low in saturated fats, animal fats, and butter. And so what we want is to minimize that bacteria in the gut that makes beta-glucuronidase. And so we can think about any type of fiber decreasing beta-glucuronidase activity. And flaxseed is just such a wonderful example because flax is a phytoestrogen and also a nice source of fiber. I often have my patients take their flax and fresh grind it. When you grind it up, you're getting that phytoestrogen effect as well as the fiber effect. Pelvic congestion syndrome. So sometimes it's not endometriosis. It's this other pelvic congestion syndrome that's causing the pain. And particularly if we didn't go through and do the laparoscopy to fully diagnose endometriosis, oftentimes we find out later that it really wasn't endometriosis we're treating in the first place. And so I wanted to talk just a bit on pelvic congestion syndrome,